What's up guys, welcome to another video and welcome to my channel. If you are a new person on here, please do hit the subscribe button and join the STI channel. So as promised on my previous video, today I'm going to do the sexual transmitted infections in males. So go ahead, invite your boyfriend, your husband, your uncle, your nephew, your brother, your brother-in-law, invite all of them to come and watch this video because I am about to assist them to stop getting into our consulting room and say, so yeah, let's get into today's video. Okay, so on today's video, it's going to be a little bit different from how it was with females. Today, I'm just going to share the names and the signs and symptoms that one should look out for to be able to diagnose themselves or to be able to say, oh, I'm having a sexually transmitted infections and I need to go to the clinic. The first one, it is called the male urethritis syndrome. So the male urethritis syndrome is basically when a male gets to have a discharge, like a whitish discharge that comes out of his urethra. So the male will come in complaining of a whitish or a milk-like discharge, or they will be complaining of dysuria. Dysuria is burning urine or painful urine. So they're gonna complain of painful urine, they're gonna complain of a whitish discharge. And the other thing that males needs to understand when it comes to sexually transmitted infections and consultations is that the nurse or your doctor will always have to assess you guys. I know it is a little bit embarrassing for you to come into my consulting room and find a tiny little human being like myself, and that particular person says, undress, let me see your penis. And with male urethritis syndrome, it goes to a point where if I don't see the whitish discharge when you expose your genitals to me, it means I have to ask you to like milk your penis so that I can see if anything will come out, because often as a nurse you will not see it when you ask the patient to expose their genitals, but the moment you ask a patient to milk their penis, then you get to see that whitish discharge being secreted on the glands. So the questions that your nurse is going to ask you is, are you sexually active? Were you sexually active in the past 3 or 2 months? Because sometimes a lot of people will say, oh, the last time I slept with a female, it was last month, thinking that sexual transmitted infection could not be from that sexual encounter. Sexually transmitted infection signs and symptoms can actually manifest even 2 months later after having a sexual encounter with someone. The second sexual transmitted infection that male gets to experience that is very common is called the scrotal swelling. I think it explains itself. A sexually active patient will have swelling or pain on the scrotum. So even if it's not swelling, but as long as there is pain, there are chances of you having a scrotal swelling syndrome. Okay, so your scrotums will be swollen, and the nurse will confirm this the pain by palpating your scrotums to like see where the pain is and what aggravates the pain. So the other thing that nurses gets to look at is if your testes are rotated, or if they are a little bit elevated, or if there is any history of trauma. So obviously if there is a history of trauma, then that doesn't mean it's a sexual transmitted infections. It could be something else. So yeah, again, you will be expected to expose your genitals to your nurse or your doctor. They will also eliminate non-tender swelling that is thought to be due to non-sexual activities. So as much as in females I said there are other reproductive diseases that do not include sexual transmitted infections, so also in males we need to like eliminate the possibilities of other reproductive illnesses. So we have to eliminate those. We have to eliminate history of injuries. We have to palpate the scrotums to see if they are rotated or they are elevated. If all of those are not there, then it simply means you are having a sexual transmitted infection that is called scrotal swelling. Now let's move to another type of sexual transmitted infection that a male can experience, and that is genital ulcer syndrome, aka GUS. With genital ulcer syndrome, a patient will come in complaining of genital sores or ulcers with or without pain. So there might be sores or ulcers around your genital area, with pain or without pain. So I know a lot of people will stay at home, especially if the ulcers are not painful. Male are people that likes to endure things, and anything that concerns their genitals, they just don't want to like consult, and they are embarrassed to even go and see a doctor. So I know a lot of patients will stay at home with those sores or those ulcers, mainly because there is no pain. Stop it, because you are aggravating the condition and it could have complications. So do not stay at home and saying, they are not painful, they're gonna go away. They're not gonna go away unless they are treated. So the questions that your nurse or your doctor is going to want to find out around genital ulcer syndrome is, have you been sexually active in the past 3 months? And if so, you will be treated for genital ulcer syndrome, which is a sexual transmitted infection. And the other thing is that when you are HIV positive, there are great chances of you developing skin conditions. So sometimes you might develop genital ulcers or genital sores because of an unknown HIV status. So if you haven't had sex in the past 3 months, then your nurse or your doctor is going to request you to take an HIV test, because that could be the reason for you to be developing genital. The other condition, the last condition that I would like to talk about in terms of
I'm within.
Yo, bophelo baka ke sempheo. So the last condition that we're going to cover in terms of male sexual transmitted infections, it's going to be Balanitis. Balanitis is when a patient comes in complaining of soreness, itchiness of the glands, inability to retract the foreskin, as well as malodor. So we're talking about soreness or itchiness of the glands. The glands is the head of the penis, like the area that has an opening, that is the glands of your penis. So if it has soreness or if it is itchy and inability to retract your foreskin, like retraction is when you try to pull your foreskin back or you try to pull it forward. And also malodor is like a smell that comes out of your genitals that you are not comfortable with and you are not used to it. So that is Balanitis. If you're having those types of symptoms, you could be having Balanitis. But let us see what nurses and doctors look at to confirm that you really are having Balanitis. So they will obviously want to do an HIV test, right? And they will have to assess if really your foreskin cannot be retracted. And if your foreskin cannot be retracted, then you are immediately referred to the hospital. If there is an inability to retract your foreskin, then you are immediately referred to the hospital. You cannot be managed in the clinic. But if your skin is able to be retracted, then it means you are going to be treated in the clinic, and that simply means you are having Balanitis. So yeah, these are the sexual transmitted infections that males get to experience quite a lot. And I just want to urge our brothers out there to go to your consulting rooms, go to your local clinic, go and consult whenever you are feeling any abnormalities in your genital area. Do not be shy to expose your genitals to your nurse if it's a female, to your doctor if it's a female. Don't be shy. We don't even look at your genital areas as with sexual thoughts. We are just medical people that are there to examine you and to assist you. So we don't care about the size of your penis. So we are not even looking for the size of your penis, but we are looking for the signs and symptoms that will help us to confirm our diagnosis. So yeah, I hope this video will assist males to visit our clinic quite often, because I know most of the people that visit clinic are females and children. Males are shy to visit clinics. Males have a tendency of thinking clinics are meant for the weak, or medical consultations are meant for the weak. And to be honest, not that I am bashing anyone, but I would advise people to start visiting their clinics much more often than they do visit general practitioner, mainly because in clinics we literally follow guidelines that are created by Department of Health, and in GPs I don't know what do people follow, but I've realized that there are people that visit general practitioners, and there are general practitioners that don't even do an HIV test. Some, they don't even do vital signs, which are things that are regarded as vital in the healthcare system. So yeah, I hope you find the video informative and you will share it with your male counterparts, you will share it with your friends, you will share it with your cousins, you will share it with your brothers, your uncles, your husbands. Yes, I said your husbands. Even your husband, you need to share this with your boyfriends, everyone who is a male in your family or in your circle. Please do share the video with them. Maybe it will assist them with a problem that they never ever spoke to anyone about it because of embarrassment and the stigma that comes with having sexual transmitted infections in the community. So yeah, if you are viewing my videos for the first time, do not forget to hit the subscribe button and be part of the Ness Z channel. I will see you guys on my next video. Love you all so very much. Bye guys.